Welcome along to this grand round session this afternoon. My name is Kevin McConville, for those that don't know me. I'm Associate Dean for Learning and Teaching, and it's my great pleasure to be here today with Professor Aali Sheen, and we'll learn more about him in a moment. Within that, the Dean sends his significant, sincere apologies that he cannot be here with you today, as does Tom Farden, who normally facilitates these grand round sessions. So we're going to start off slightly differently today. For those of you that may or may not have read the book yet, and we will attempt, as we're going throughout this conversation this afternoon, not to provide any spoilers. So if you want to see the full effect and read the full effect, then you will still have to buy and read the book. But we will kind of touch on concepts that are tied in and around the book. However, towards the end, there is a short session before the epilogue, which is about a mock courtroom. So we're going to start with that, just as a way of introducing what we're going to be talking about today within it. So, Professor, I assume this is your correct title?
Yes, sir, or Lord may never have arrived. Yes, that is correct.
Do you feel you are unfairly discriminated against in life, both as a child and an adult? If so, why?
Yes, I must confess this is true. From as early as I can remember, I guess it was mainly due to the color of my skin more than anything. When a child, it was physical, with obvious accompanying bile and vitriol spewed in my direction for all to hear as a description of who I was. And if you let me finish, as an adult, a more surreal encounter occurred when an impenetrable barrier erected before me at an immigration desk.
Has it stopped you achieving your goals? Has it prevented you from earning the title professor? Did it stop you from undertaking the job you so coveted to do since you were young?
No, although maybe I may have achieved what I have sooner or more easily.
So what is your problem, Professor? Don't you think you're taking things a little too far? Don't you think maybe you have a chip on your shoulder? Don't you think maybe you should just brush it to one side, as there are much worse things that could have happened to you in life?
Yes, you're right. At least I'm alive. I'm physically intact. I still have my health. And I don't have anything growing inside me that could upset my normal life and end it prematurely. I'm still working. I've been afforded a little respect. But have you heard of mental cruelty? Have you heard of mental anxiety and depression? Have you heard of the desecration of your brain cells so that to such an extent that you are prone to respond with fear and anguish each time you're confronted because of your race, defined by your color rather than your persona and not by just ingreses, even those that look like you with an air of resentment? Do you know what it's like never to be given the benefit of doubt? This is where I am today and will be until I go 6 feet under.
So you have failed to accept your color, your race, and your perceived inferiority? Or is it just that you have a sensitive persona which society shouldn't be blamed for?
I think society has made me what I am today. The mental battering and at times physical bruising I've experienced has created this individual before you. Culpability must rest with our environment, but it is now time for our own human community to change. And thankfully, it is altering, perhaps not everywhere in the world, but in the place I call home. My case rests.
Thank you, Professor. I'll pop this across just to make certain. So, to put that in context or to look at it, obviously, you can go and read the full book, and it will be helpful for that. I'm going to start at the beginning of the book. And again, thank you for your time, energy, efforts, artisan in creating kind of what really is an insightful book, and hopefully we can talk and touch on it and do some justice to today. I'm going to start a little bit perhaps at the beginning, looking at the kind of your childhood events in those early chapters, kind of 1970s, London in particular. And I just want to, I guess, get you to think back, to reflect back to how that was for you kind of growing up at that point in time.
It was normal, what I perceived as being normal. And I've also commented on the book that it didn't matter who you were, if you're what I call the native, Anglo-Saxon Celt or someone of immigrant stock. We all were struggling at that time in the 70s. I think most people didn't have money. There weren't a huge number of jobs about. Do you remember the power strikes? Hang on, hold on. So we had electricity to go during the day. But for what happened to me was normal. So I knew where my school was. My brothers and I, from the age of about not 4, 5, 6, 7, 8, we had to go to school by ourselves, which was normal practice in those days. And we knew how to stay out of trouble. We knew that if we veered down one road where there's a group of lads standing, we'd be in trouble, and we would experience, a lot of racial disharmony, and we would suffer. So we knew how to stay away. Once we got inside the school, it was safe, and then we had to negotiate our way home. So I think for us, it was the fact that our parents were immigrants was the difference. And for me, thankfully, our school was only across the road from the council estate. So we didn't need mum to pick us up. Because if she did come, we insisted she didn't speak to us in the native Urdu. Because if she did, we would be in trouble the next day at school for speaking a foreign language that no one could understand. And it was frowned upon, and it was inferior. So that was then.
I'm interested in your choice of language. I know you're being in some ways diplomatic, but it's not you being in trouble really. The fact is that it created trouble for you.
Yeah.
It created opportunities for you to be picked out from the other crowds that you were with or not with within that. And I was very much aware in reading that book about your own awareness of kind of, mum's presence or not at the gates. I think there were particular more troublesome episodes when it sounds like it's quite significantly. You were literally battered and bruised and different fire within it.
Yeah.
But always, I guess, in your radar, that consciousness of mum's presence or not. You had school awards where you chose not to inform parents so they would not turn up within that. So that must have been a tricky balance, kind of balancing school life and home life, kind of, and how did that make you feel at times?
It's two different lives, and it's what I was used to. At school, I was very English, and all my friends were white, majority. I had black friends as well. And at home, we had a very Pakistani household. And it was actually, I call it a very South Asian household, because in our council estate, it was mainly white people that lived. I don't like to use that. The natives, Anglo-Saxons, I say. And there was 4 families, which I described. There was us that were originally Pakistani. Upstairs were an East African family from Malawi. And then downstairs, there was a Tanzanian family. They were Gujarati. And then across the road, there was a Parsi family. Parsis are Freddie Mercury. He's a Parsi, we all looked the same. So we all used to hang around together. But we're from different parts of South Asia. And we were one entity. And the reason I brought that up in the book is because I said I wouldn't talk politics, but when Sadiq Khan, before he became mayor, a lot of my Hindu and Sikh friends that I grew up with at school, they got a picture on a postcard. If you want London to look like this, if you don't want London to look like this, don't vote for Sadiq Khan. It was for the other party, and it was of a London bus being blown up because he was a Muslim. And all my friends voted for him, because what I've always felt, when you're British born South Asian, you're one entity, because we look the same. And that's what my parents found familiarity in. Whatever policy is happening back in the subcontinent's left, but we all used to hang around together and look out for each other. So we'd be picked up from one of the other mums, and and sort of, you know, look after there. And then we all, and I learned a lot about traditional cultures. Like we'd go to the Tanzanians' house, and my mum and dad said, "You need to put your hands together every time you walk in." And we were only 5 and 6, and then that was normal for me. It was something that was normal, and it stayed with me to this day. So, what you're anyone who was born at the time I was, and whether they're of immigrant stock or not, will be able to tell you that we lived in this cosmopolitia, you know, and we all sort of lived together. But I think one factor that combined us all was we're all poor. We had no money. I don't know who had money in the 70s, but I'd like to see how they turned out. But we all used to just hang around together, and we all lived together. But there's a few things I didn't. That chapter, I think it's best if the readers read it. I don't like to talk about it, but unfortunately, we did have excrement thrown through our door. It's really sad. I'm not going to get emotional, but my brothers and I we knew why that was being thrown through our door. And my mum had to tidy it up. And it's sad, but the way I can analyze it is that a very close friend of, because half my year people from Northern Ireland, I don't know if that still happens in Dundee. So one of my very close friends was from Northern Ireland. And he said, watch on Netflix, Once Upon a Time in Northern Ireland. I found it shocking that he went home to this. For him, that was normal. For me, that was normal. Yeah. Having excrement thrown through our door was normal. Being called the P word was normal. And it was called here, not in this lecture theatre, not in medical school, but in this city. I got it here, but it was normal. I was just in a different city. You know, I was a student. I was 18. It stays with you. Now, if anything bad happens to me, that word comes to the back of my mind. And I feel like that word. And it's there, and it happens all over the world. So, you know, I'm proud of my country, but any tribal differences that are perceived anywhere in the world, and we see it on the news every day, it happens all over the world. And I think it's important for us to just keep giving the message out that this is wrong, you know, and, you know, the world should change. But yeah, I think that's the best way I'd describe it. It was just normal for me. It was what I expected to happen. When you read it's chapter 2, isn't it? Yeah. When you read, was it chapter 1, I think?
It overlaps, I think. A little bit.
Yeah. When you read chapter 1, you will find it harrowing. You will find it upsetting. But it didn't happen too often with my parents. It was mainly directed children on children. So, but when it happens to your parents, you never forget it. You never. No.
This is really about you, but
yeah.
In response into your question, so I'm Northern Irish by background, so I can very much relate with what we were talking about on that 70s component. And we might come back to that at a further date. Thinking about the background that you're from, and I'm thinking about where we are with university now, we would talk somewhat in some of the concepts about expectation, or the current nomenclatures about widening access and about making certain that universities reaching out to different cohorts that might have less opportunities to come, or think about medicine in particular for us, I guess, the university as a whole. Can you talk a little bit about kind of expectations setting off your school at that point? Because they seem to think it's somewhat, I couldn't work out from you, but how much whether they thought it was the norm for you to be thinking about applying medicine, or it was just too high an aspiration, and how you manage that?
Yeah, I think it was too high an aspiration. I went to an old grammar school, so it was quite, you had to compete to get into the school. It was very competitive.
Yeah.
And the boys, there's boys at that school, they're just beyond me in terms of levels of intelligence. But I just felt that it wasn't expected for me to get in. So they made me apply to do pharmacy at Polytechnic at the same time. And I didn't want to because it was an extra 10 quid, you know. I had to convince my dad to give me, because I didn't think you wanted to do pharmacy. I said, I know, but the head of science says I have to apply. And, you know, my O levels, GCSEs, were mainly B's and C's and a couple of A's, you know, which is very good at that time. And so they said, you're not going to get a place. And I got 5 rejections, you know. So I got 2 offers for pharmacy, Polytechnic. And I don't know, I just felt, let me just do my A levels. And I got the grades to get in here. And I think it's an interesting component of the book because you need a bit of luck. And my luck was the postal strike of 1988 because you had to post your applications. And the postal strike saved me. So Royal Mail, I love you. So there's a postal strike, no applications going in. And I, occasionally when I operate, I said, do you know anyone that's got into a medical school through clearing, applying to a medical school? Do you know anyone that has got into a medical school that they didn't apply to through clearing? I said, Prof, because that's my nickname. I said, no, that's impossible. I said, me. And that's how I got in. And it was absolutely incredible, you know. But that opportunity was given to me by this medical school. So that's why you buy this book, 100% of the proceeds. And by the way, when you publish a book, you don't make money. But the small percentage that I get, all of that goes to the alumni here. And I was very specific when I originally arranged this with your predecessors. I said, if you look out for those that have been on free school meals, live in a council estate, are single parents, or just poor. Those are the 4 criteria that I said, if they get a place at University Dundee, then I would want the money. That's where the money's going. And I know that's where it's going. So that's why I felt that, you know, I've written my story, but that's what I want because I believe education is a way out of poverty. But is education a way out of discrimination? And that's the question the book will try and answer. And that's for you as a reader to decide if you think it's true or not.
Do you think we've swung too far the other way? So we certainly do try and identify our widening access cohorts, the kind of criteria that you've spoken about to make certain that they have a different type of offer now to medical school. And you will know, obviously, from being maybe a professor within Manchester as well, though, that, you know, we now have still the same high A-level criteria. We have the online UCAT, we do multiple mini interviews and variations in the theme. Do you think we swung too far in a different direction? Because like your story, mine is not dissimilar. You know, I failed first time around, didn't apply to the universities that I applied to Dundee, who offered me an interview and gave me in. I know that Dundee, one of our previous deans, talks about his application and entrance into medical school. He got into Dundee via clearing. So it was obviously picking up something that was different then compared to now. Do you think we've gone too far in a different direction?
No, I think you should drop the grades.
Yeah.
Your website, because I had a look at it, and was it A-star AA you need?
Yeah.
But you've got 1 grade lower for those that have gone to really, you know, inner city schools. I think that's correct. You don't need 3 A's to become a good doctor. You don't. You need to have a good memory. So you got to have an A at least, or AAB is fine, or even A and 2 B's. But the A-star makes it slightly different, you know. But you need a good memory. You need to want to do the job. The other thing is that you know, my kids, and none of them are going into medicine. One of them possibly wants to do teeth, and he's going to apply here. So, and what's interesting is when I see some kids, especially from immigrant backgrounds or poor backgrounds, you know, and their families are proud of them becoming doctors because it is a way out of poverty. You do earn more than the average person, and you've got respect in society, and you've got a noble profession.
It's a tricky one, isn't it? I mean, you know, your story tells about that and how hard you've worked to get to where you have been, and yet then you're saying, well, if my children were to apply to medical school, I'd probably say no to them. Interestingly, what we're noticing in current applications, and I think that's representative of perhaps what's going on within the NHS and the media overall, is that we are about maybe to turn full circle in terms of we're getting lower thresholds of applications. You know, there are currently technically more applicants and or less applicants than there are spaces at medical school. So are we going to see something that will turn around where we go back to clearing because we're just desperate to have people, but maybe pick up again the right people within it? Let's talk a little bit about Dundee then. Why? I know some of it was tied in with your application per se, but Dundee and your experiences within Dundee as a medical student. Tell us a bit about that.
Do you want me to go specifically to the bit of the book?
It's up to you.
I loved it. I thought the education was very good. And when I finished 5 years, I decided to go home, and because I felt if I was going to set up roots back down in England, I should go home early. So I became a house officer in London. I was way ahead of the other medical students, the junior doctors. Cambridge guys, these are the guys I mainly work with. I was just way ahead of them. And the way I was taught, I knew how to handle a sick patient. I could fill in drug charts, and I could cannulate, and I could do stuff. I'd already done a lumbar puncture, you know, as finally a medical student. And I just felt the final year, the clinical year, was just so good. And the final 4 weeks, by surgical and medical attachments, you're basically just working with a house officer the entire time. So I felt better prepared. But what I wasn't prepared for, and I only thought about it 10 years later, was my personal tutor. In the book, he felt, in my second year, I went to see him, and he asked me if I was struggling with reading the books. And I said, what do you mean? He said, well, what language do you speak? I said, I speak English. No, your other language. I said, Urdu. Oh, Urdu. And then I do make a point, because it's not pronounced Urdu, it's pronounced Urdu. You know, I do make a point of that in the book. So he said, aren't you translating everything into Urdu? I said, well, I can't read and write. And he goes, oh, right. So I thought you read everything and then translated it into Urdu and then reread everything again. And I was a second year medical student, and this is what he said to me. So I came back to my flat and I told my flatmates, and they just laughed. And I laughed. I thought it was quite funny. It's not until 10, 20 years later, I realized what he said to me was appalling. It was appalling. And it was just astonishing, you know. And then I had a problem in final year psychiatry. I had a problem, and where we had to go to a prison, and I had the consultant psychiatrist with me, because we're going to prison to interview some inmates. I said, okay, great. So we were driving, and I saw this beautiful countryside in Scotland, and I said, oh, it's lovely here, isn't it? He goes, oh, what's lovely? And I said, oh, it's just nice countryside. Because I had you down as a typical Asian boy. You're liking bricks and tall buildings and inner cities. And I said to him very politely, I said, well, most immigrants live there because that's where the jobs are, and we get all the jobs that no one else wants to do, and that's why we're there. I don't think we're going to live in the country. There's no job here, and that's why we're there. That's why we're immigrants. And I said that to him, and he didn't like it, you know. And he wrote a letter to the professor here. And that professor, he called me in. He goes, we have a problem with you. I said, what's that? Because the other thing I said to him was, he said, you're not the keenest student I've had. I said, well, I didn't have many questions. My colleague asked a lot of questions. And to be fair to her, she's very bright. She's asking questions, I feel, to make out she's keen. And she already knew the answers to them. And, you know, it's part of being a student. So I said, I didn't have any questions. And once I did, I asked you, because you're not very keen. So the professor came to see me, and I failed my finals in psychiatry. So I graduated in December, and that was it. It's like one subject, and all my colleagues were devastated. And I was devastated. I was 23 years old, and I was devastated. All my friends are becoming doctors, and I've got to do an extra 5-6 months. So about 10 years later, it worked out in my favor, because being out of sync actually helped. So I kept getting all the good jobs. So, but at the time, I just thought, he's cost me £3,000 as a student, fees and this, and all my colleagues are working, all because of those events that happened in my psychiatry attachment. And I cannot believe he would have asked anyone else those questions. But I answered him back, and I answered him back very politely. You know, all I commented on was the countryside. That's it. That's all I did. And I know the final exam, because the secretary at the time, she's well and truly retired now. There's no issues. It's 30 years ago. She said, the final exam, it was an MCQ, did I pass it? She goes, yeah, you passed it. So he dragged me into a pass-fail viva, and he made me fail. And that's really sad. And I honestly believe that to be true. I can't prove it. There's no point going to court of law, nothing. You know, it's just sad. And I think my answering him back, the question you need to ask me is, if I was a white male, would that have happened to me? And I think probably not. I think probably not. And it's sad for me to accept that. I think that's true. I think that's true.
It's nice to see, albeit really difficult circumstances, that you can still find somewhere that the silver lining with being out of sync, and that's helped you.
Oh, it did, yeah.
Forward in a different way, or a different experience within it. And there are, just I guess for the audience as well, there I know some of these are challenging circumstances, right, but there are also very positive elements within it. You talk about one of the surgeons who I suspect, I know who you're talking about within it, but the whole observation of the normal abdomen is a way to move forward with the abnormal abdomen within it. That's obviously led you strongly into a surgical life and kind of FRCS. So tell us a little bit about that, because again, I think it's relevant to how colleges currently and historically have been constructing exams. I'm interested in that, your experiences of FRCS and how you undertook that versus, I guess I'm assuming now you're maybe an examiner on the other side, and how you may view things.
Well, yeah, I mean, the examiner question I can answer quickly. There's an Alpine course for the final fellowship exam. I teach on that course because I ski, and I refuse to be an examiner because once I'm an examiner, I'm not allowed to teach on that course. So there you go. So, but no, because I was out of sync, my second house job was my surgical house job. And I worked for a chap called Tom Loosemore in London. And Tom was newly appointed consultant. And he liked me. And I worked really hard. And sometimes we'd have no SHO. So it's just me and the reg. And I used to come to theatre a lot. And I just got operated. And he said, you seem to be quite good at this. I was showing some dexterity. And I said, oh, yeah. And he said, is this your second house job? I said, yes, I saw that. Because everyone else there first. He goes, I've noticed because you're a bit better than the others. Well, I said, well, I've already done 6 months. And he said, yeah. Why is this your second house job? And I didn't know at the time. I said, oh, I failed finals. He said, oh, surprise. And then he actually gave me encouragement. He first of all felt that I was good. And I felt that I wasn't good because I'd failed finals. And so, you know, I always go back to any students that download and listen to this. I always go back to Churchill's comments. I'm pretty sure I get this correct. Failure is not fatal. Success is not final, but it's the ability to carry on that matters. And I think if you do fail, you will be a better doctor. And I felt that my failure had allowed me, and working for this guy, to go into the surgical field. But it's hotly competitive. You got to do a lot more reading. I have to admit, I didn't realize I knew any anatomy, because I thought I passed first MB anatomy. I thought that's enough. But this anatomy that you have to learn as a surgeon is pretty intense. And so I just went into that field, but it's hotly competitive. But there's a fellowship chapter. Do you want me to talk about the fellowship chapter?
I'm happy to. I guess
I think you should read it, because it's a feel good moment. It's when I do the fellowship exam.
Yeah.
And I think I don't want to spoil it if you're going to read it, because I was told by my friends and some of my bosses, you will not pass because you're not white. I was told. And I accepted it. Again, it's normal. My childhood that was normal. The P word was normal. My tutor asking me if I'm struggling with the English language, it's normal. So that's my normal life. So being told you're going to fail the exam and you will pass eventually, I accepted it as normal. But it didn't stop me. And I kept going. But you are more likely to get barriers in your way if you are a woman or minority, or if you have any of the 7 protected characteristics. You're more likely to have barriers in your way. But a lot of white male patients and colleagues of mine have read the book and related to it. So there you go. See? And I've said that in the book. I said, even if you're a white male, you have every right to succeed in what you want to do. But they will have less barriers. However, the white males that come and spoken to me, their parents and grandparents are coal miners, so they've gone to medical school at Guy's in London or gone to Oxford, and they felt different, but no, I just think everyone has a right to succeed if you're good enough. And for medicine, being a surgeon, physician, GP, or whatever, if you're good enough, you've got the right to succeed. And it must be, I think it must be impossible for you to choose all these bright 17-year-olds coming out with amazing grades. I think it's impossible for you to choose. So I believe it's not just one interview now. There's like lots. I think that's good, but I don't think you need a string of A's. I honestly believe that to be true. You don't need all 9s and 8s. You need a good aptitude, you need a sense of maturity, and you need to be able to care.
I'm mindful of our time. I'm just going to check in if you have any questions from the online audience at all at the moment. Not at the moment, but that's fine. So we have maybe about 5-10 minutes left if anyone else thinks. You talked about the book. I'm wondering one of the questions that came through, and you've touched on a little bit, but kind of your motivations behind the book and to author the book.
I'd had enough. COVID came. I had enough. The Amsterdam scene, and I'm a professor of surgery now. I'm in my mid-40s, something like that. My passport wouldn't read on the screen, and there was 2 Africans. Theirs wouldn't read, and I just walked off. And the lady said, "Stop. I'll tell you. You can read it. You can make up your mind whether I was overreacting, I was sensitive, or I have a chip on my shoulder. I'll let you decide." And she goes, "Sir, sorry." I said, "What do you want?" She goes, "Have you?" I said, "No, you're not having my passport." And now I'm in trouble. So you're not having my passport. So what do you want? She goes, "You didn't read." And I said, "Well, it's your machines at fault, not me." She goes, "Sorry, sir, you can't go through." I said, "There you go. What's wrong with it?" She goes, "Just the machine didn't read." She scanned it. She made a call. So who are you calling? I thought you said the machine didn't read. So if it's read on yours, who are you calling? you know, I needed to make, I said, you profiling me? I said, you profiling me? Am I going to detonate? I actually didn't say the word, but that's what I felt like saying. Because once I say that word, then I'm in trouble. I said, you think I'm going to do something? You think I'm going to commit some sort of heinous crime? Is it the color of my skin you don't like? I've got a Muslim name. It's half Irish Catholic. So Muslim name, half Irish Catholic. Maybe that's a bad combination. You don't like it, you know? And I said, what's your problem? No, sorry. Then the young guy came up to me and I said, look, don't talk to me. All right. You don't talk to me. And I was being rude because I'm twice these people's age. I said, I'm both older than both of you. I'm a professor of surgery. I put bodies back together. So don't give me hassle. Give me my passport. Let me go. She gave me, they're actually now scared of me. Gave me my passport and I walked out. That's how I felt. I felt I needed to do something. And George Floyd, I mentioned George Floyd, and it just brought all of these memories came flooding back. Well, whoever you are, wherever you are, you're an individual. Your memories create you and your life experiences. And they will change you as an individual, and hopefully you'll learn from your life experiences. A lot of women have spoken to me about my book and said how inspirational they found it. And I did a little controlled experiment in theatre once. And you're going to find one of my answers quite bizarre. So I apologize, and I don't mean to be rude. I said to everyone, if you came back, how would you come back? What would you want to be? All the women said they'd come back as a man. I was saddened by that. And then everyone went round, and there was one chap who's from Ghana, and he's quite funny. So what about you? Nigerian? He goes, no, not Nigerian. So he didn't like that. And then they said, what about you, Prof? I said, I want to come back as a Texan, 5th generation ranch owner. I chew tobacco. I've got a couple of kids down the road from another woman. I own this ranch. I've got cattle. I can do what the bleep I like. And I vote Republican. No one can say anything to me. And he said, really? I said, yeah. He said, really? I said, no. But, but you see, I was creating a picture of someone that has privileges in life because of where they are and where they were born and what they do. I would be voting Trump, you know, and because he's going to save everyone. I don't know if you know this. And they can do whatever they want. No, they're American. They're not going to do anything. No one can say anything to him. But I've had problems. I had problems in Egypt. I had problems in my own country. I had problems in the United States. You know, it's not nice to sit a little bit closer to guys with guns, and you don't know if you're going to get Mo or not. You know, it literally was like that. And I didn't know, and I didn't know, and I knew why I was there because, as I said, it's normal for me. That's normal, you know, to be taken aside and questioned for my religion is normal, you know. And I think every single person listening online, whoever reads the book, they have a story, and I learned a lot from my friends. You know, half my year people from Northern Ireland. And as an 18-year-old boy from South London, you know, the news in the 80s wasn't pleasant from issues that are going on in Belfast. And I met all these wonderful people. And I just thought, I realized then the media had polluted my mind with nonsense about some of the most wonderful people that are still my friends to this day, just because there's troubles going on. And my mind was poisoned. Like now, people's minds are poisoned with Islamophobia in the media. Because there are a handful of people that create a bad picture for 1 billion people in the world. And they create a bad picture. So, yeah.
And ask you that. You'll tell from my accent as well.
Yeah.
Northern Ireland.
Yeah.
So I'm listening to you talking, and it's more of an observation. But your book feels to me like a positive disruptor.
Yeah.
That it's something that we shouldn't forget this.
Yeah.
That almost unconsciously, maybe in some ways we have.
Yeah.
That we've got equality policies, you know, we're running campaigns debates around, you know, inclusion and
Yeah.
equality now, but yet still this remains.
It remains.
I would ask you another question about the term Islamophobia.
Mm.
Would you, it's become common parlance, but to me it's racism.
It is, yeah.
So
It is.
what happened to the word racism? You know, I just would like to get your view on that.
We see Islamophobia exists in my native India because my parents came to Pakistan, if you read the book, but I'm native Indian and I have been for thousands and thousands of years. And I've done my DNA test and I've got vegetarian legs. I am Indian, you know.
Can I ask a supplementary?
Yeah.
Which is really about when we were talking about, you know, this being a positive disruptor,
Yeah.
not forgetting, and you said a little bit at the start about, you know, because I felt that cringe as well. Say, oh, you're a war baby, or don't give us the war baby story, but it was a reality. And
Yes.
Is that
Yeah.
how you feel in terms of your?
It is, yeah. No, I've learned a lot watching that program on Netflix. I had no idea what was going on. All my friends going home to this, you know. No, I think you're right. It is. I'm hoping it'll be positive, but yeah, I think racism, yes. Islamophobia, slight difference because you can be the same race, different religions. Exactly what's happened in Northern Ireland. You're the same people. You're genetically the same, but you follow religion slightly differently, and that's created a difference. So, yeah, I mean, I just think it's positive. You know, everyone that's read the book says you're really proud of your country. After everything you've been through, you're still proud. I said, yeah, but I just need to win the World Cup. Sorry, I'm saying that in Scotland. All my Scottish friends will be appalled. And well done on the rugby last week. I was actually, there's a small part of me in Scotland. I was actually pleased. Calcutta Cup. I was very pleased with that result. One more question, Kevin, or
We have time for one more question.
Yeah. My children haven't experienced anything that I've experienced, nothing. My children, they have an advantage, they're third generation, their parents speak like the natives, you know, slight advantage. If you go to the Royal College of Surgeons, any one of them, look at the council, there's a lot of work to be done. There's a lot of work to be done. Until we have someone of African, I say black because I think South Asians, I'm South Asian, I think we're overrepresented in the medical field. I think we are, you know, but someone of sort of like North African, Moroccan, Sudanese origin, becoming president of the Royal College of Surgeons of Edinburgh, that is when you have achieved something. That is it. And I think that until I see that day, I'll say nothing has changed enough, but a lot has changed positively. My children haven't experienced anything that I experienced, nothing at all. Maybe I've given them a slightly privileged education and so on, but they haven't experienced anything. And I think we are moving. That's why I think when I have immigrant doctors, a lot of immigrant doctors come work here, and I said, well, I hope you stay. First of all, we need you. And I think personally, this is the best country in the world for you to live and work in. And I think you will succeed here. If you work hard, you got good at, you will succeed. And I say that to every single of my doctors, especially the immigrant ones. You know, I do think we live in the best country in the world. I think we're helping people, and we're doing a lot of good things around the world. And at home, and I think it's really good. And this institution is absolutely amazing. And what this institution gave me, I will never forget. It gave me that start in life, without which I wouldn't have had. So, and I've complimented my medical school.
You have, Professor Sheen. We have run out of time. We have people jumping in the debate at the back for the next lecture, and I know online they'll be heading off to clinics. I'm going to finish with a quote from the ending from your own book you've taken from Hippocrates. wherever the art of medicine is loved, there is also a love of humanity. And I think that's been a clear line of thread that's come throughout the book in terms of kind of elements that you've identified that are important for us to retain. And it's nice to see that touched on within Dundee specifically. But in terms of being both a consummate surgeon, but also in terms of the painted surgeon, thank you very much for your work and authorship for this book.
Thank you.
Thank you for coming today.